Alrighty guys, we're going to talk about tourniquets. As far as commercial devices go, we have several. We have the rat, we have the soft, we have the cat, we have the soft. The ones that we use in the EMS system in Albuquerque and Bernalillo County is the cat. This is the soft, and then when worst case, we have a triangle bandage with a Yonker. I'll show you how to set those up. Your cat tourniquet. Very long piece with a bunch of Velcro on it. The way you're going to set this up is you're going to take the loop, you're going to feed this in like a belt, size it to your patient's arm, which I'll show you, and then you're going to cinch this down. This section right here is also Velcro, so when you're done cinching and you've occluded blood flow, you secure that, wingless doesn't come out. With the soft T, very similar, except this has a clip on it. So make sure that's all set up. You're going to do the same, size it up to the patient's arm. You're going to tighten that all the way down so that it's locked in place. And same thing, use the wingless. And then there's a little hook right there that you're going to secure that into. So it keeps it from moving around. The old school way, use a triangle bandage. You're going to tie that around the patient's arm good and tight. You're going to take your Yonker and you're going to start cranking that sucker down until you've occluded blood flow, and then you'll tie that down. Alright guys, so one of the first things we're going to do for bleeding control and shock, we're going to assess our patient. So we're going to assume that this patient has a left forearm lac that is arterial. So we start with our basics. We assess the patient. So we determine where the bleed's at, we hold direct pressure. If it starts to bleed through, with holding direct pressure, hold more direct pressure. If we determine that that is no longer adequate and it's still continuing to bleed through, I'm going to have my partner take over holding direct pressure. I'm going to grab my tourniquet. So, for the purpose of this, we're going to use the cat tourniquet. It's going to come in its packaging. We're going to get it set up to where the strap is through the loop and ready to go. We're going to put this above the site of injury. Make sure that is cinched down really well. At this point, we're going to cinch this down. Now, when we cinch this down, we're going to feel radial pulses. We want to make sure these are absent, and we want to make sure the actual site that is bleeding has been well controlled. While we're still holding direct pressure, we can also wrap around this to make a good bandage. And at this point, we need to transport. If the patient starts showing signs of shock, we're going to move this patient to the floor. We're going to move the patient to the floor, and we're going to start treating for signs of shock. That is diaphoresis, increased respirations, pale skin. So we're going to place the patient in a supine position on the gurney. We're going to get our oxygen tank set up. We're going to place the patient on a non-rebreather. We're going to set that up at 15 liters per minute. We're going to make sure that the bag is filled. We're going to grab a blanket. Keep our patient nice and warm. Turn the heat up in your truck. At this point, also request for ALS intercept. Transport to the hospital. Let the hospital know well in advance that you have a patient that's got a tourniquet on. This should be a code 3 return because this is considered a threat to life or limb. Reassess your patient every 5 minutes.